Prior to December 2020, when Nigeria began to witness a steady rise in the number of COVID-19 cases, infections were relatively low, with a case fatality that was less than 2%. However, the statistics is changing very fast, and it is constituting a major concern for the Presidential Task Force, which announced that the government may consider another lockdown if the cases continue to rise.
The Presidential Task Force is very concerned about the increasing daily numbers that we are recording. Yesterday, 6th of January 2021, we recorded 1,664 infections. This is yet another all-time high in Nigeria, and we must all take full responsibility through compliance and vigilance.
We are saying that if these numbers continue to go up and we start having significant deaths, we'll have no option. And if we do not want to lock down, now is the time to make sure that we follow these non-pharmaceutical interventions.
Nigeria recorded 1,664 single-day cases of new infections on Wednesday, the highest in recent times. Case fatality has also risen to 3% as 1,324 persons have been lost to the virus. Perhaps more worrisome for the task force is the infection rate amongst people between the age bracket of 20 and 50 years.
The majority of the cases recorded are between the ages of 21 to 50, and this poses a lot of risk to the elderly. During this holiday, I'm sure most of us went home to see our grandmothers, our grandfathers, and so in the process, if we were careless, we would have transmitted this virus to them.
The Nigerian government is anxiously awaiting the delivery of COVID-19 vaccines approved by the World Health Organization, but none of these will be administered on its citizens without the certification by the National Agency for Food and Drugs Administration and Control, NAFDAC.
We are cognizant of the fact that it's not enough to just present the vaccines, but providing information that articulates very clearly that these vaccines have gone through those processes that will assure us of their safety. Working with NAFDAC, the COVID-19 vaccine will not be an exception.
There are currently over 15,000 active cases of COVID-19 in Nigeria. This besides the 77,299 cases that have been successfully treated and discharged from various hospitals.
Today is January 15. Well, we'll come back to the report that you saw in a little while. But for those who know, January 15 is a memorable date in Nigeria. But what is that about? I guess we want to find out a little more about that from Kayla Megwa, who is standing by right now in Abuja. So, Kayla, tell us what is happening, where you are, and what are we to expect today?
In the month of November.
Hi, happy Armed Forces Remembrance Day to you. Every single thing happening right here in Abuja is all about this cenotaph that you can see right on top above my head here. It's about the unknown soldier, and everyone is talking about that right here at the National Arcade in the nation's capital. Is right opposite the Eagle Square. Well, the events have just started. The guest of honor is going to be Mr. President, and of course, as usual, this is a yearly event. So we're looking forward to some of the things that are going to be celebrated today. Remember, this is the very first Armed Forces Remembrance Day in the time of COVID, so that is something to note. Also notable today at the National Arcade is the fact that the wreath laying ceremony will be going on. We're looking forward to that. We're looking forward to the last post. You know, lots of soldiers have died in the past few years. And we're also going to be looking at the families of fallen soldiers and how much support the government has given to them all these years. Last year, 2020, was the golden jubilee of the Nigerian Civil War. And of course, some funds were allocated to families. We're going to be looking at that. And then, of course, we're going to be running commentaries live right here at the National Arcade in the nation's capital. It is Armed Forces Remembrance Day 2021. Everyone is geared up, and I'm seeing that there's a lot of COVID-19 protocols that have been adhered to, even where the government officials are going to be standing right in front of me. I'm looking at the IG, the Chief of Air Staff, the CNS, and the Chief of Air Staff as well. They have actually allocated spots to them on the floor. That way they can keep social distancing. As you can see from the soldiers around me, everyone is wearing their face mask. They wouldn't let me take mine off to do this even. So everyone is putting on the face mask. They're observing social distancing. And it's going to be a very interesting, solemn event, Ayo. And we're looking forward to all the things that will be happening right here at the National Arcade. And of course, going forward, what is being done about those who give their lives so we can stay safe in Nigeria, Ayo.
Well, it's really very interesting when you put it that way, people who give their lives so we can, you know, stay safe and all of that. And that's really admirable. One thing that I can just hope, and you may want to speak to that as well, Kayla, is how impactful you hope that this would be on the populace who know that this is happening and who are wondering, okay, after this, will I be willing and able to give my all to serve Nigeria with all my strength? That's the hope, isn't it?
It is. It's a very important point you've brought up. You know, when we were younger, everybody wanted to be in the military. You know, it was an admirable thing to join the military. But the willingness to make that sacrifice, does that still exist in today's Nigeria? Do young people even remember that today is Armed Forces Remembrance Day? Do they understand the significance of it? Has it lost its luster? Not among the people here, apparently. Everyone here is really geared up, and I'm seeing the families of some of the fallen soldiers as well, really excited about what's going to be happening today. But it does bring up a question of patriotism. If you've ever been to the military, ever grown up around the military, one of the things you will realize once you enter the training is that they tell you that you are the front and the back. You're supposed to protect and, of course, attack. So you're basically you're supposed to protect the Nigerian, you know, lay your life down for the Nigerian, for Nigeria. And that's a very important question. Is that something many young people are willing to do today? And how do we get that patriotism back? It's a very important question for our time. And we'll be seeing how it all unfolds, Ayo.
Hopes are very high because I remember that, you know, the day we're celebrating today is strategic because that's the date the war ended, the Civil War ended in 1970. And the hopes is that this will never go to those dark days again. But we'll have to stay in touch with you, Kayla, just to be getting the bullet-by-bullet points of the activities of today. So thank you. Hopefully, if it is possible today, before this program is over, we might still cross over to you, Kayla, to give us more. But thank you very much for the good job you're doing, and please keep in touch.
Thank you so much, Ayo.
All right, so that's one set of soldiers. There's another set of soldiers fighting COVID-19 in Nigeria, along with several others. We've been talking, every time we talk about COVID-19, we talk about what the federal government is doing, the Presidential Task Force on COVID-19 is doing, the Federal Ministry of Health, the NCDC, and the rest of them. But then there are the responsibilities of states. And every state is supposed to take practical, direct responsibility for their citizens. And that is why every time you have reports from the NCDC, they detail what is happening in the various states. Of course, one of them is Ekiti State. And we have with us this morning to have a conversation with us on what Ekiti State is doing to curb the COVID-19 pandemic in the state is Dr. Olabanji Filani, who is the Commissioner for Health in the state. Thank you so much for joining us this morning, Doc. Well, most certainly you would be as concerned about COVID-19 as everyone else is all over Nigeria. Do you want to give us an update on what are the peculiarities of the fight in Ekiti State?
Thank you very much, first and foremost, for having me and for the question you've asked. Yes, indeed, the COVID-19 pandemic is has entered its second wave. And here in Ekiti, we are putting together all that is required to ensure that we're able to address this holistically. I think I'll start first and foremost with the numbers that we have as at today. We have 44 current cases, 4 of which were new cases active. We have just about 453 cases in total here in the state. 52% of these cases have come from the capital, Ado-Ekiti. So there's a bit more focus on Ado as we think about addressing the challenges that we have in the state. The governor has been very active from onset to ensure that we put all that is necessary in place. So in terms of prevention, we're constantly on radio, on TV, using all the different information channels to ensure that we can reach out to people, informing them and providing informative solutions with respect to what needs to be done. Practice social distancing, use your mask, and ensure that you wash your hands. Secondly, is that we're ramping up testing very aggressively so that we can test as many people as possible. The more you test, the more likely it is that you know who is ill, and you can very quickly respond to that by treating them adequately. And thirdly, is that where people need to get treatment done, where necessary, we'll move them to the isolation center where they are treated there. Thank you.
Well, then, that's not part of the strategies the state has also put up from information available to us is that you have come up with curfew and banned the gathering of more than 20 people at any given time. What has been a concern to the federal government, the PT of COVID-19, and perhaps Ekiti State as well, is how well or not people are complying with COVID-19 protocols in the state. You have told us what the state is doing to ensure that people do the needful. How do the people respond? That's definitely something that's of concern.
Okay, so I think I'll start with the curfew. We've always had in place that people should avoid gatherings after 8 p.m. until 6 a.m. in the morning. We chose not to use the word curfew for a long while, just so that we're mindful of the economic activity within the state. But when we realized over the holidays that it appeared that there were still a number of people flouting it, then we decided to use the word curfew. So this is essentially something that had always been in place from the very beginning. With respect to the numbers in terms of gathering, the goal there is just to be, it's a very preventive measure to ensure that we minimize potential spike in the state here. So those are the things that are important to note.
Well, clearly, one of the strategies a number of people are looking at, which has become popular as well, is the race for the vaccine. And there are rumors, all over the place that maybe, it's already in town, it's being sold. I guess we'll come to that if it is something that you want to take on. But then, a critical aspect of the preparation for the vaccines when eventually they come and are made public to the states is the storage. And we know that, Ekiti State has just acquired some equipment for that. Tell us about that.
Okay. So what we have are solar direct drive refrigerators that we're already now installing in our primary healthcare facilities. These equipment essentially will give us the capacity to be able to store vaccines, not just the regular EPI vaccines, but where it then comes into play, some of the vaccines that fall within the standard temperature of between between -4 and 8 degrees. So the Pfizer, for instance, and I think it's important that we make this clear, the equipment that we've put in our facilities will certainly not be able to store the Pfizer vaccines, the Pfizer mRNA vaccine, because that requires a specialized kind of storage. However, the other vaccines, such as the AstraZeneca or whenever the Johnson & Johnson comes into stream, will certainly be able to store them. I think it's also important to note that this is a strong collaboration. Our efforts in getting this equipment is a strong collaboration between the government of Nigeria at the federal level and here at the state, working very closely with the NPHCDA. Thank you.
Are there things that are peculiar to Ekiti State, especially when it concerns health workers? Because you are not unaware that a good number of people are concerned about that. You know, how are the health? What kind of responses are you getting from the health workers about how people are complying or not about things that need to be done, especially concerning COVID-19? We'll come to others in a while.
Okay. So first and foremost, I think it's important that we appreciate our health workers here in Ekiti. They've been excellent. There's no other word to describe what we've seen. They've been at the forefront from the very beginning, even when the etiology of this illness wasn't clear, and they've done a significant amount of job to ensure that we can have very low mortality. I think secondly is also then that they've also adhered very strictly to protocols and ensure that they're able to discharge their duties professionally. So it's worth commending them for that. With respect to what they see or what they think about how people, the level of compliance, the challenge is not just within Ekiti. I think there's a compliance concern across board in Nigeria, but also across the world. Perhaps maybe because there's some fatigue from people with respect to what needs to be done. But the beautiful people of Ekiti here continue to listen to their governor. Like I mentioned earlier on, we're constantly on radio, we're constantly on TV, ensuring that people, are able to adhere to standard. And where that is flouted, particularly in institutions, malls or event centers or any other sort of institutions or gatherings, enclosed gatherings, there is a task force that ensures compliance.
Can you give us an update, especially when it comes to, you talked about the fact that Ekiti State has ramped up testing. Can you bring us up to speed about how many have been tested, how many tests have been conducted so far, and what's the plan to speed it further so that at least we are sure that we are not going to have any fatalities anytime in Ekiti State?
So the national guideline is that we test 1%, between 1% and 2% of our population. In Ekiti, that brings us to about 32,000 to 36,000, depending on the data that you're using for 1%. At the moment, we've done just a little under 10,000 tests. But I think what's more important is what we're now currently doing. Just last week, we had in partnership with one of our private sector friends, we're testing 1,500 healthcare workers and civil/public servants in the state. And this is in further commitment of the governors. I mean, this shows even further, right, the governor's commitment to the welfare of people. And with that 1,500, that takes us quickly, right, to closer to the number that we want to achieve. But beyond that is that we've also decentralized the testing centers. Initially, this was about 6-7 months ago, we were only testing in the capital here in Ado. But now we're testing across all local governments. We've decentralized testing to all the general hospitals in the state, 22 of them across the 16 local governments. And so we're collecting samples there. Just before Christmas, I'd also written to the Permanent Secretary Hospital Management Board, informing them that every case that comes in now should ideally be also tested. So the case definition here in Ekiti ensures that once you have a fever or once you have a cough, you must be tested. There's no new malaria any longer, essentially. And so we need to be able to test as many people as possible. And we're seeing those numbers gradually move up.
Concern that's all over the world, in Nigeria and perhaps in Ekiti as well. And that is the phobia for the vaccines. So the challenge, the number one challenge is getting the vaccine. And the second is persuading people to take the vaccines when they eventually come out. How far so far with that one? Do you have the same fears in Ekiti State? How is it being addressed?
I think the fears are universal, and it's not just in Ekiti, it's across board, like you rightly mentioned. Just yesterday, someone sent me a video, showing why the vaccine should not be taken. But there is already a tool that has been developed, with support from the WHO with respect to how countries or even states should get ready for vaccination. And part of this includes demand creation and communication. It ensures that we're able to provide the right set of feedback to people. We would not, I don't think that we will completely quell the fears, but I think what we need to be able to showcase, right, is that these vaccines are safe and they would not alter your DNA or any of the other concerns that people have. It's also important to note, and maybe I should use this opportunity, is we're in interesting times, admittedly so. I think the last time we probably had a pandemic of this global order, right, with this total number of deaths must have been, decades ago, right? And it does mean that things that would happen would be different from what has typically happened in the norm. So when I hear people talk about the speed at which the vaccines have come to the market, we also need to recognize that a lot of things have gone into ensuring that that happens, right? Governments all over the world have put in significant amount of resources to ensure that the typical bureaucracies that would take time and the red tapes are minimized so that we can bring this to market and reduce the number of deaths globally.
Well, some people will also say that,
before we take vaccines, attitudes about the illness have to be real. In other words, people must believe that there is an illness. I know that you have praised very strongly the people of Ekiti State and their attitude towards the illness. And we saw that exemplified in a gentleman who reported his son and asked him to go back to where he was coming from. That was during the lockdown in Ekiti. However, there still remain people, a large population amongst the populace, who believe, or a demographic I should say, who believe that the COVID-19 is non-existent. Have you been able to judge this kind of attitudes and see how you can disabuse their mind that indeed this illness is for real?
I don't know if you heard me.
I don't know if you heard me.
Well, I don't know if you heard her.
Yes,
were you able to hear her?
No. I just started hearing you, but I didn't hear what she said.
Well, her question is essentially saying that you have praised the people of Ekiti State, to high heavens about their responses and all of that. The question she's asking is the believability of people. Many people don't believe that it is real. So how have you been able to, how do you persuade people that the disease is real in the first place before you can persuade them to take the vaccine?
So it continues to remain a challenge. I'm not downplaying the fact that there are a good number of people who don't believe that the vaccine exists. I mean, the ailment exists. Two new approaches that we're using now three, is to first and foremost inform people that, look, we now know, maybe the second wave, but just before the second wave, we now know that not everybody who has COVID is likely to, need hospital care, and not everybody who needs hospital care is likely to pass away. And so the narrative around the fear of COVID from a mortality perspective needs to change. It has to move away from that to saying, look, it is important that even if you have it and are asymptomatic, you can never tell how the other person is going to react to it. So that was the first strategy that we put out. The second strategy is also to recognize that even when government speaks, there are other leaders of thought in the state that are important to engage and ensure that they are seen to be engaging the people. And this includes the traditional rulers and the religious leaders as well. And so we've been engaging them, asking that they speak to people and informing them about what the realities are with COVID. The third strategy then, of course, which we're now going to begin to put into place, is also just to showcase that there are indeed people who actually do have it. And when I say people, I'm not talking about myself or any other member of the cabinet, because, again, there's the perception that it is a disease of those who are either in government or the elite. But that just your regular, normal day people who have either had it or who have had a colleague or a friend or a family member have it, who just speak to it, right? And speak to it from their perspective and the implications, not just for yourself if you had it, but also for the caregiver in this instance. So those are the three-pronged strategy that we're using, and we'll continue to engage. Of course, as always, we feel the temperature of the citizens to better understand where the issues are. Last year, I think mid-December last year, we carried out a survey to get a sense of where we consider the biggest challenges were. And some of them, when we figured out with face mask, was the comfortability of the use of face mask, right? So again, the states put out a strategy along that, explaining to people how you can even make your own face masks and ensure that they're comfortable in the states, in using them.
All right, well, Dr. Olabamji Filani, Commissioner for Health in Ekiti State, thank you so much for your time and your thoughts this morning.
Thank you for having me. And thanks to the viewers as well.